More than 1 million children globally die each year due to problems associated with prematurity, making preterm birth the leading cause of death in children under 5 years of age. Even among survivors, there can be long-term consequences, such as retinopathy of prematurity, chronic respiratory diseases, and impaired neurodevelopment. DHA is an omega-3 fatty acid most commonly found in fatty fish. Several population cohort studies have reported associations between fish intakes before or during pregnancy and reduced risk of premature birth. One study looked at countrywide omega-3 fatty acid intake and preterm birth rates across 184 countries and found that preterm birth rates decreased linearly as omega-3 fatty acid intake levels increased, up to a threshold of about 600 milligrams omega-3 per day. Additionally, a 2018 Cochrane systematic review and meta-analysis, which included data from thousands of women, determined that when compared to a placebo, omega-3 fatty acid supplementation during pregnancy significantly reduced the risk of preterm births less than 37 weeks gestation by 11% and early preterm births less than 34 weeks gestation by 42%. Because DHA is mainly found in seafood, even a nutrient-dense diet does not always ensure an adequate intake. In fact, 96% of the global population falls below the optimal intake range. Additionally, concerns about mercury and other contaminants may lead some women to consume less seafood during pregnancy. And while approximately 90% of pregnant women consume a prenatal vitamin, DHA supplementation still remains much lower. First, women can make sure they have adequate DHA intake prior to becoming pregnant. Recent clinical trials have shown that women with low DHA blood status early in pregnancy have higher risk of preterm birth compared to those with adequate status. Most expert groups recommend a minimum of 250 milligrams omega-3 per day for the general adult population. Women of childbearing age, especially those trying to get pregnant, should consider DHA supplementation in the ranges of 250 to 600 milligrams per day, consistent with expert recommendations and population-level findings to reduce the risk of preterm birth. Second, all pregnant women should take a prenatal vitamin with at least 450 to 600 milligrams of DHA. The European Food Safety Authority recommends 450 milligrams omega-3 daily for pregnant women. However, this recommendation is not specific to preterm birth risk reduction. More importantly, most trials that showed reduced risk of preterm birth used doses somewhat higher than what is currently recommended, and the latest studies have reported levels of 800 to 1,000 milligrams of DHA were effective, especially for women known to have a low DHA status at baseline. If a blood test or diet questionnaire confirms a pregnant woman has low omega-3 status or intake, she should consider an even higher dose of 1,000 milligrams DHA per day. Many mothers, especially those with busy modern lifestyles, find it challenging to meet their nutritional requirements. To cater to their evolving needs, DSM offers a range of purpose-led maternal nutrition solutions, market-ready product capabilities, and end-to-end support to take your new product to market with speed. At DSM, we offer the highest purity, natural triglyceride DHA with superior organoleptic properties, enabling manufacturers to deliver DHA in the smallest serving size possible. Reducing the risk of premature birth can help babies lead longer, healthier lives, and DHA has an important role to play. DSM's Enhanced Lives portfolio offers clinically studied DHA that delivers the essential building blocks needed to create a healthy future for mom and baby. The maternal nutrition solutions in DSM's Lives portfolio are 100% plant-based, environmentally sustainable, non-GMO, and free from environmental and marine contaminants, with reduced impact on marine ecosystems. At DSM, it is our purpose to positively impact 7.5 million pregnant women and their newborns by helping to support healthy full-term pregnancies.